Urinary incontinence is the involuntary leakage of urine. It is a common condition that can range from a minor inconvenience to a significant issue that impacts daily life. Urinary incontinence can affect people of all ages, but is more common in older adults and women. Types of urinary incontinence. 1. Stress incontinence. Description: leakage occurs when there is pressure or stress on the bladder, e.g., during coughing, sneezing, laughing, or physical activity. Causes: weakness of the pelvic floor muscles or sphincter due to childbirth, surgery, or hormonal changes like menopause. 2. Urge incontinence, overactive bladder. Description: a sudden and intense urge to urinate, often resulting in leakage before reaching the bathroom. Causes: overactivity of the bladder muscles due to conditions like infections, neurological disorders, or unknown triggers. 3. Overflow incontinence. Description: the bladder doesn't empty completely, leading to dribbling of urine. Causes: blockages, e.g., enlarged prostate, weak bladder muscles, or nerve damage from conditions like diabetes. 4. Functional incontinence. Description: physical or mental impairments prevent a person from reaching the toilet in time, e.g., mobility issues, dementia. Causes: external factors like arthritis or cognitive decline. 5. Mixed incontinence. Description: a combination of two or more types, commonly stress and urge incontinence. Causes and risk factors. Urinary incontinence can result from temporary or chronic factors, including temporary causes: urinary tract infections, UTIs, constipation, certain medications, e.g., diuretics or sedatives, alcohol or caffeine intake. Chronic causes: pregnancy and childbirth, strain on pelvic floor muscles and nerves. Menopause, hormonal changes weaken tissues supporting the bladder. Prostate problems, enlargement or surgery. Age, aging weakens bladder muscles and reduces bladder capacity. Neurological conditions, stroke, Parkinson's disease, or multiple sclerosis. Obesity, extra weight puts pressure on the bladder. Chronic diseases, diabetes or chronic cough from smoking. Diagnosis. To diagnose urinary incontinence, a healthcare provider may: 1. Review medical history and symptoms. 2. Perform a physical exam, including a pelvic or prostate exam. 3. Order tests such as urinalysis, to check for infections or abnormalities. Bladder diary, to track fluid intake, urination times, and leakage episodes. Post-void residual, PVR, to measure how much urine is left in the bladder after urinating. Urodynamic testing, to assess bladder function. Imaging, ultrasounds, or MRIs to check for structural issues. Treatment options. Treatment depends on the type and severity of incontinence, but common approaches include: 1. Lifestyle changes. Limiting caffeine and alcohol. Maintaining a healthy weight. Managing fluid intake to prevent overfilling the bladder. 2. Pelvic floor exercises. Kegel exercises strengthen the muscles supporting the bladder and urethra. 3. Bladder training. Learning to delay urination or establish a regular schedule to improve bladder control. 4. Medications. Anticholinergics calm overactive bladder muscles, e.g., oxybutynin, toltrodine. Beta-3 agonists relax bladder muscles, e.g., mirabegron. Topical estrogen helps restore tissue health in postmenopausal women. Alpha blockers relieve prostate-related obstruction in men. 5. Medical devices. Pessaries inserted into the vagina to support pelvic organs. Urethral inserts, temporary plugs to prevent leakage. 6. Minimally invasive procedures. Botox injections relax bladder muscles in urge incontinence. Nerve stimulation, electrical impulses to improve bladder control. 7. Surgical options. Sling procedures support the urethra or bladder neck. Bladder neck suspension stabilizes the bladder. Artificial urinary sphincter, commonly used for men after prostate surgery. Complications. Skin irritation due to prolonged exposure to moisture. Urinary tract infections caused by incomplete bladder emptying or poor hygiene. Emotional impact, anxiety, embarrassment, and reduced quality of life. Living with urinary incontinence. Hygiene products, pads, liners, or absorbent underwear can provide confidence. Behavioral strategies. Plan bathroom access and avoid triggers. Support groups. Connect with others managing the condition for emotional support. Would you like advice on any specific type or treatment method?